I'm Jessie. I'm a student nurse, and today I'll be demonstrating on how to administer TPN and then do some trach care. So first I'm just going to do some hand hygiene and then walk into my patient's room and do a general safety check. So hi there, Fred Fredrickson. I'm Jessie. I'm a student nurse. I'll be with you today. I'm just going to be doing your TPN as well as doing your trach care afterwards. Is that okay? Yes, he consents. So I'm just going to raise his head at the bed as well. So we're just doing a general safety check, making sure that he's not in any distress at all, and just ensuring that it's okay. There's nothing on the floor here. And now I'm just going to go in with my physician's order and just check that I have the right patient here. So I have Fred Fredrickson. MRN number is 00990127. I see that on both. He's 37 years old and it looks like he has no known allergies. So I'll just get him to state his name for me. Thank you. And your birth date. Thank you. And do you have any allergies? He says no. So now what I'm going to do is just do my first check with my TPN. A previous nurse already hung it, so I'm just going to take my physician's order here and just check it to my TPN bag and make sure that I'm doing this correctly. So the right person here, I see Fred Fredrickson. I can see his date of birth here as well as 21/02/1982, which is 37 years old, and his FIN number as well as 0991027. So now we know that this is TPN, this is a TPN bag, so we know that our physician's order is correct. Our amino acids is 100 grams, I see 100 grams here as well. Our dextrose is 200 grams, I see 200 grams in my physician's order. My lipids is 50 grams, that's also 50 grams. And it says to infuse over 24 hours at a rate of 83.3 mLs over an hour. And that also states it at the bottom, 83.3 ml over 24 hours, so that is also correct. So now we've checked our physician's order with our what we know there, and then I'll also check compared to my requisition. So again, I have Fred Fredrickson. Their correct date of birth is 21/02/1982. That is correct. And I also should have stated with my physician's order, we're giving this IV, and the right time and frequency is now. So then we're going to keep going here. So again, amino acids is 100 grams, 100 grams. Dextrose is 200 grams, I see 200 grams. Lipids is 50 grams, I also see 50 grams. And I see a total volume of 2,000 ml, which is true on both of these. And then we'll just go through electrolytes. So sodium is 120, I see 120. Potassium is 60, I see 60. Calcium is 10, I see 10 again. Magnesium is 10, I see 10. Phosphate is 15, I see 15. No acetate. And then multivitamins is 10 mLs. Trace elements says 1 ml, which is also true. And the chloride is 150 ml. And the concentration is 1,117.38 osmolality per ml. And again, it says 2,000 ml over 83.3 mLs over 24 hours, which is true. And it was prepared 2 days ago. And it is 1580 calories. And also, again, the right route is IV. We know that we're giving this through our central line, through our white port, and the right time and frequency is now. So that is correct. So now, just going to do some more hand hygiene. And put on my gloves just to get started here. So I have a piper here, which is just going to more. Now we're going to program our pump, and we're going to have to label our line because we're giving TPN, and then I'll do my second check after that. So I see here that this is a TPN bag. Our tubing is primed here. We can see that it's primed. We have the blue filter, that means that it's TPN tubing. It's inputted into the pump. So now we're just going to program our pump here. So I'm going to click primary. I'm going to click change mode. Oh, here we go. I'm going to go label line. And then I'm going to go all Oh, here we go, total parenteral nutrition. So we have a rate, again, we know that it's 83.3 mLs per hour, and the total volume is 2,000 ml, and we know that as well. So we'll just leave this like this for now, and now we're going to do our second check with our requisition, our bag, and our pump to make sure that we have everything correct one more time. So again, I see Fred Fredrickson, date of birth is 21/02/1982, which he's 37 years old. The right amount of volume is 2,000 ml, and I see 2,000 ml here. Amino acids is 100 grams, dextrose is 200 grams, I see 200 grams again. Lipids is 50 grams, I see 50 grams. Sodium is 120, I see 120. Potassium is 60, I see 60. Calcium is 10, I see 10. Magnesium is 10, I see 10. Phosphate is 15, I see 15 over here as well. Chloride is 158 as well, I can see that here and here. And then I also see vitamins is 10 ml, and trace minerals is 1 ml. And again, it's 2,000 ml at a rate of 83.3 mLs per hour over 24 hours, which I can see that here. It was prepared by pharmacy 2 days ago, and so now we're good. And it's 1580 calories. So now that we're done our second check here, I have my 10 cc flush. I'll just prime that first to make sure you get all the bubbles out before we put it into our central line. Okay. So we can see this is capped off here. I'm just going to leave this at my patient for a second and go to my central line. Again, we're using the white lumen because that's the one that you use for TPN, and you always need to use a central line. It says that on the bag as well. Some alcohol swabbing for 30 seconds, letting dry for 15. And then a 10 cc flush because we have to do that for central lines. This syringe is a little bit funny, but see how we're going to attach. I'm going to open up my clamp here. I'm going to instill 1 ml. I'm going to aspirate. Yes, I see blood. Got a bubble, and then push, pause, push, pause. Push, pause to make sure it's patent. He has no pain at his site, he's okay. And now, I'm going to take off this, ensuring that I keep it sterile. And I'm attaching that. So now I'm going to go back up. I'm going to make sure that all my roller clamps are open. I see that this is open. Everything is good to go. And right before I click start, I'll just click confirm primary because we know it's correct. This is when a second RN would come in and do their check with the physician's order, the requisition, the TPN bag, and my pump to make sure that I did all my 5 rights correctly throughout. And again, we know that in our second check there too, we're giving this IV. We know that, and the right time and frequency is now. I forgot to say that before. So now I'm going to click check with my mom. So I start to begin. Okay, and you're just watching for 3 drips, ensuring that that's gonna actually infuse. It's not gonna, there we go, 1 drip, you should see another 2. And then I would document this, that I administered it, and I would also just state that I'm watching for labs, I'm doing blood glucose checks, things like that for this patient because he's on TPN. So for the rest of the demo, I'm just going to turn the pump off just so it doesn't do anything weird. So I'm just going to click stop, or actually I'm going to just turn it off completely off. Just for the purpose of the demo. So now we're going to swing over here. Again, I'm going to do some hand hygiene again. And we're going to go to this trach. So now we're going to do a chest tube a trach safety check. First thing you want to do is ensure that your suction works. So there's 2 knobs here. You click on, and on here you can kind of hear it. I'm just going to put on a pair of gloves. 1 second. Just so I can check the end. You want to check the pressure and ensure that it's between 80 and 120. sometimes the ones in the lab don't work as well. So when you intermittently suction, so we can increase. So yeah, that's between 80 and 120 when we intermittently suction, so that's perfect. And for the purpose of the demo, again, I'm just going to turn off the suction because it's very loud, except for when we go suction him later. The second thing you want to do is just make sure that this is connected properly. I see it's connected, it's intact. And then, actually, I'm just going to go grab my physician's order here. Thank you. I was going to grab it before. So we know that it says the cold pot should be at 60%. So here, you line up
and make sure that it is connected to my collection system.
So 60%, which is about 9 liters or so. So again, that should be at 9 liters. It doesn't actually go up. Sometimes these things are just a little bit messed up. And then for the purpose of the demo, I'm also just going to turn this off just because it's a little bit loud. And then when you go down towards your patient here, you want to ensure that it's actually misting at the patient. So you should see misting when it's on and it's humidified with sterile water. Next thing I want to do is just go through your safety bins. You should have sterile water, normal saline, some clamps. I see some clamps over here, or sorry, dilators. That's my bad. I see dilators here. Some extra trach sponges, an extra actual trach in case it came dislodged of the correct size, an extra inner cannula of the correct size, which I believe is 7, some extra trach ties, and then an ambu bag, manometer, and suction catheters of the correct size as well. So you kind of have your 10 things there. So first thing we're going to do is pre-oxygenate our patient to before we suction, and then we're going to do manometer check after. So what you want to do, this patient can deep breathe on his own. So with having the oxygen on at his prescribed rate, you just want them to take a few deep breaths while you have an O2 sat monitor on him. If he was satting well and he was doing well, then you know that you're okay to take off his oxygen. So let's say that is the case. We're going to take off his oxygen now, turn it off, and just leave it off to the side. And then we are going to suction prior to his dressing change. So, first thing you want to do is collect the correct suction catheter of the correct size. So I go by the -2 times 2 rule. So we need a 10 French. I see a 10 French here. So we are good. You want to take now your suction off, and then peel back, ensuring that you keep this end sterile. And you put it together. Oh. I think this just comes off.
Oh, and before starting, you always want to make sure that you have your 2 cups forceps.
So we know that that is good. I'm just going to keep it in the package for now as I turn on the suction. So again, for the purpose of the demo, I'll turn it on. We'll show that it's still between 80 to 120 for suctioning, for intermittently, but then I'm going to turn it back off just for the purpose of the demo because it's very loud. So here we have on, and then you can just test with your finger. I see it's between 80 and 120. So I'll just turn it off so it doesn't cause extra noise, and then I'll show you guys how to suction. So when you pull it out, you want to keep 5 inches to 6 inches sterile. We're going to do 1 pass per suction catheter. I'm only going to do 1 pass, and you want to go between up to 15 seconds for an adult when you suction, and intermittently. You don't want to hold onto your suction as you go in. Sorry.
And I'm going to pour my normal saline in.
Okay. So this is about 5 to 6 inches. And I'm going to go into my patient until you hit the purification. So I did. And then on the way out, you just want to twist and intermittently suction as you come out. Okay, so you get all the secretions, so now he's good. I'm going to dispose and put this back in my clean glove.
And also I'm going to open
and then dispose of this in your glove as well. Your dirty gloves. Just leave this off to the
So now I'm
side.
going to use,
Not sure. Oh, Emerald, can you pass me my hand hygiene bottle? Thanks.
so I want to make sure that it's done.
And then, sorry, I forgot to say that you should have suctioned up sterile water into this tubing so that you can clear out the tubing. So now we're going to check cuff pressure. So I did some hand hygiene here. And now I'm going to put on some new gloves. So yeah, we're just going to take his cuff here and the pressure manometer, and you want it to be between 20 and 30. So I'm just going to alcohol swab this for 30 seconds, let dry for 15, and then this portion as well you can, just to make sure. I have another alcohol swab here as well. So alcohol swab for 30 seconds, let dry for 15 again, and now it's done. So what you're gonna do is attach. Okay, so perfect. I see it's between 20 to 30. Oh, and then if you overinflate, you can just release some air. You can see it's between 20 and 30. Then you want to take it out again, and then right away put it back in to ensure that it's still between 20 and 30, which I can see it is. So we checked cuff pressure and it's okay. And now we're gonna do his dressing change of his trach gauze and the inner cannula. Okay, we'll just put this to the side here. So yeah, you just wanna make sure that this is at the correct level. There we go. So just maybe expose him a little bit. And now I have my inner cannula. So I'm going to first just open this up, making sure that you keep it sterile. Okay. In real life, you would have to go get a new one, which is possible. Which is fine, but for the purpose of the demo, then I'll just reuse this one as well.
No, I know.
But again, you're supposed to keep it sterile, so you just keep it like that. So what you want to do is take out his old inner cannula. Okay. And then dispose of that in your dirty glove. And then I can grab this new one and put it in maintaining sterility. So I'm doing no touch technique, I'm just touching the tip while I insert it in. And again, it's the correct size of a 7, and you want to hear that snap. And then I'm also just going to pull out his old trach gauze as well and dispose of this. Okay, so I'm going to do some hand hygiene again. Throw out this and do my sterile dressing.
Do you want to start? No, I'll just. Okay, I'm just gonna go grab.
So we're just gonna set up this garbage here. We don't need this drape or anything like that. That can just be garbage. I'll add my sterile water. And then you just want to push these forceps out. Push this out. Okay. I'm gonna add some more big sponges.
Don't worry.
Throw that in the garbage.
And then we'll try to
And
get
add
you
some.
one more
Okay,
half
hopefully
hour
this will be
because you lost technically 25 minutes. But if this is fine and you're confident with it, then
Okay. Okay.
I'll just dispose of that. I'll add a couple more.
I'm like sweating. Okay. We can start.
Okay, so first thing you want to do,
Student nurse and
I'm just going to put on my gloves, sorry.
Minister have them via continuous infusion and also do a chest tube. So I'm going to perform and right begin.
So you just want to go in with a cotton tipped applicator and do a half circle on the top
There is 17 minutes left, so if you're thinking of doing another one,
Before
and a half circle on the bottom. That's done. And now we're just going to go in with
Hi Wendy, my name is Sue. I'm a student.
two 2x2s just to ensure that the outer part is also clean.
See your armband. Can you tell me your name? Okay.
You also want to remember that you just want to assess the stoma site as well. So again, the top, kind of more outer part,
So I'm going to go to my heparin bag.
clean.
And I'm going to make sure that I have the correct patient, which I just got, and it's Wendy Holmes and the correct bin. I'm going to make sure that I have the right drug, which is heparin.
And the bottom as well.
Exactly what's ordered is heparin.
Okay, so now that that's done, I'm just going to do a quick dry.
Which is 1350 units per hour, which is what I have. And then I also want to make sure that the tubing used is one with no ports, which is what I have here. And you want to ensure that it's tubing with
So again, the top,
you don't want any
just try to get in there as best as can just because it's Jake, so it's a little bit difficult.
heparin running for 2 minutes. And the correct time, which is the time is now. So I'm going
And the
to
bottom.
take my wand and I'm going to put in.
So now that I'm done that, I'm going to fold up my trach gauze
I'm going to put in
and
for
put it
heparin,
in.
VTE.
Okay,
And my
so just making sure that you keep it sterile, and I like using a cotton tipped applicator too. It's a little bit difficult because of Jake.
drug amount and then
You just want to kind of get in there.
so just to do a second check, so I have Wendy Holmes.
The most important part is just keeping the inner circle around his trach sterile. So once you have a grip on the edge here, you can see, you can kind of pull it out.
Which is what I have here. Dilute volume.
Again, Jake is a little bit difficult.
The concentration is
And then the other side
here.
as well.
My dose is 13.
Once you have that in, you can kind of just pull it out. And again, we don't have to do his trach ties or anything like that. The previous nurse did that. Now that's garbage, so I pretty much just dispose of this. And then I'm just going to put back on his oxygen at the correct amount.
And I'm going
So again, at 60% at 9 liters. And then just put it back on. And I would document as well. And that is the end of my video.